Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Springfield, Virginia, discussing the latest advances in dental technology and how they can restore your dental health and give you the smile you've always desired with one of this area's leading dentists, Dr. Robert Argentieri. Dr. Argentieri received his dental degree from Georgetown University. He is a member of the American Dental Association, among other associations, and is recognized widely as one of this area's top dentists. Welcome, Dr. Argentieri.
Very nice to be here. Thank you.
It's our pleasure to have you on, your first time, in fact, on our program. Now, Doctor, there have been many advances in dental technology over the years, and I wanted to have you tell us about some of the more significant ones and how we can benefit from them.
Well, in the past couple decades, dentistry, along with everything else, has benefited from the digital revolution. And now we have tools that expand our ability to treat patients. And one of the biggest areas is in the area of imagery. I would say that the majority of dental offices now use digital radiographic images rather than film x-rays. And the advantages, in my mind, are very, very significant. In the first place, you don't have a piece of film. You have a digital image which you can magnify, you can enhance it, you can manipulate it, and all of these things increase the diagnostic value of these digital x-ray images. And they're portable. If a patient is on vacation in California and has a problem and goes to a dentist, in seconds he can be looking at the radiograph that you took last week.
How that's changed from
yes,
what was the option
sure.
before.
I mean, films. Insurance companies often require a radiograph to support a insurance claim. And in fact, current policy now with insurance companies is they will not return a radiograph that's submitted. Well, in the case of a digital image, it doesn't make any difference.
That's right.
It's always in the patient's file, and it will always be there, and we can always retrieve it. But with film, you have to take at least a double x-ray so that you can send one to the insurance company, which they will promptly lose.
That's right. In many cases,
yes.
they do.
And in any case, they won't return it. That adds expense to the patient, and it's much more trouble to deal with a physical piece of film than it is with a digital file. That can be, just shot across the net, and it's there in nanoseconds.
That's right. That's right. Now, I understand Invisalign is another area where the technical revolution has benefited dentistry.
Yes, and it's a digital technology. The way Invisalign works, unlike conventional braces where brackets are bonded to the teeth and then wires are used to apply forces to the teeth, Invisalign is a technology where there's computer algorithms for straightening teeth, and the Invisalign people create a virtual dental model from impressions that we send to them, and then the computer arranges the teeth according to the algorithms that have been worked out, and then a custom milling machine mills out of sheets of plastic an appliance which applies forces to the teeth, and it's a very clear, invisible retainer type of appliance.
So basically like invisible braces, if I may use that term, doctor. And
exactly.
I can see the clear benefit to the busy professionals who don't want people to know that they're obviously wearing an appliance, which would be obvious if they wore the traditional braces.
Certainly.
And here with Invisalign, it's a great alternative that gets, I would take the results are the same or similar?
There are cases that really can't be treated with Invisalign. Skeletal discrepancies, people that either have a prognathic jaw or a retrognathic jaw, and that's a skeletal problem, and then sometimes even with conventional orthodontics, surgery is necessary to overcome those problems.
Sure.
So not every single orthodontic case lends itself to Invisalign, but your point is well taken. People who just would not consider having braces on their teeth will consider this because it's a very unobtrusive type of treatment. Yes. You wear these things all day, 24/7, except when you eat, and they are truly invisible to someone at a normal conversational distance. You can't tell somebody's wearing them.
That's a great treatment option to have nowadays, especially.
We have a staff member who's undergoing treatment, and she's my exhibit A. She always will come to my patients and say, well, I'm wearing them now.
That's right.
And they do a double take, and they peer intently at her teeth,
yes,
but they can't see it.
That's wonderful. Now, who would you say would be a good candidate for Invisalign, doctor?
One of the best candidates is someone who's already been treated as a child with orthodontic appliances and has failed to wear their retainer or didn't get a retainer, and they've experienced crowding of their teeth after the correction. The crowding has come back. Those cases are very easily treated with Invisalign with wonderful results. But basically, people with crowded teeth, as long as the crowding isn't so great that extraction of teeth it would be contemplated. Even those cases can be treated with Invisalign, but that requires quite a level of expertise and experience in using the Invisalign appliances.
Yes.
So not everyone who needs extraction orthodontics can be treated with Invisalign by every practitioner.
Now, CAD/CAM restorations is another area which has benefited from the technological revolution within this field?
Yeah, it didn't exist 15 years ago.
Yeah.
And it's becoming more and more refined, and the materials are improving by leaps and bounds. It used to be that the fit of a CAD-generated restoration was not quite as precise as cast gold. But now the fit rivals the tolerances of any restoration that we can make, and the aesthetics and beauty of these things is just really amazing. They're beautiful restorations.
Yeah, I would think that everything has been enhanced and taken to another level with what you're talking about as far as the quality of the appliance and the quality of enhancing our smile to the next level.
Yeah, the restorations are just so beautiful, so perfectly fitting. It's truly amazing, and they're more quickly generated than a typical porcelain fused to gold restoration. And now we're making digital impressions. No more gunk in your mouth.
Yeah.
There's you pass a wand over the teeth, it generates a holographic image in the computer, and you do a computer-aided design of your restoration. You send that to a milling machine, and it mills it out of a solid block of either zirconia or lithium disilicate, and they can, literally turn these restorations around in 45 minutes.
My goodness.
Many dentists have milling machines in their office, and they can generate a crown for a patient while the patient's sitting in the chair.
Things have really changed, Doctor. No doubt about it, to the benefit of so
yes.
many. As far as some of the cosmetic treatment options that you have available, porcelain veneers, whitening, things along those lines, could you please tell us a little bit about those so we have an understanding of how we can benefit from those options as well?
Sure. Well, whitening is certainly the catchword of the day in dentistry.
It's the hot buzzword, right?
Absolutely. Everybody wants whiter teeth. Some people really want white teeth, which
unnatural white,
yes.
actually, in some cases.
Yes, we call it American Standard. It's the shade that they're looking for.
Yes.
And it's unnaturally white, but some people, that's what they want, and they can achieve it with bleaching, and the bleaching methods are pretty unobtrusive and not particularly invasive. It happens over a couple of weeks, and the results are more or less permanent. From year to year, perhaps you might have to touch up and do a little bit of reinforcement bleaching, but it's a very nice modality, and it gives people a nice result that they can take pride in right away.
Yes, instant.
Yes.
It's sort of the society that we're
instant gratification.
That's right. It's the McDonaldization of society. Everybody wants it now, quicker, cheaper, everything.
Yes, I want it, and I want it now.
That's right. That's right. And on the porcelain veneer side, Doctor?
Porcelain veneers are little tiny shells of porcelain that are bonded to the teeth. So if the underlying tooth structure is badly stained, or if there's chipping or crowding or wear on the teeth, we can restore the tooth to its ideal shape without grinding the entire tooth down. Veneers work best when they're bonded to tooth enamel, and it's a very gratifying technology to be able to present to someone, because when they look in the mirror when they're finished, they just love what they see.
Yes, indeed. Now, I understand you have some patient before and after pictures of some of these treatments and how these folks have benefited, Doctor, that you've been telling us about?
Sure.
Let's take a look.
As you can see from these photos, the cosmetic improvement for these patients has been, quite significant, and they're very happy with their new smiles and very happy with the treatment.
Those results speak volumes. Great work, very natural. I want to now ask you, Doctor, how long the results would typically last?
Well,
about 20 years.
I'll tell you what I tell all my patients.
Okay.
I took an extensive course with Ross Nash, who's one of the leading authorities on porcelain veneers and cosmetic dentistry on the East Coast. And what he says is, if the veneers fail within 5 years, I do them over cheerfully for no additional fee. If they fail between 5 years and 10 years, I'm disappointed and I do them over, but there's a charge. If they fail after 10 years, I'm satisfied. And if they don't fail after 15 years, I'm ecstatic.
There you go. So basically, you're looking at long-lasting results from veneers.
Yeah, I personally have cases that have survived over 20 years.
My goodness.
And it depends on the patient, like everything else. Bad habits like biting on things that aren't food, chewing one's fingernails or cuticles, people that smoke, drink a lot of either red wine, coffee, or tea. All of these things can lead to what we call micro leakage around the edge of the veneer where it's cemented to the tooth, and you get a little bit of a brownish halo
But that's no different than if we had our natural teeth.
Exactly,
and
yeah.
we did all those
you
things
would, yes,
and
you
ate
would,
and drank all
right.
those things, it would affect it the same way.
Yes, but you know, once you've been to Paris, you don't want to get back on the farm.
That's right.
So you know, if they're used to a bright, beautiful smile, they want a bright, beautiful smile forever and ever.
Yeah. They just have to maintain it by doing the right thing.
Absolutely, absolutely.
Now, we've only got a few moments left, Doctor, and you and your practice here in Springfield, Virginia, have certainly established a reputation for excellence in the field of dentistry, or recognized as one of this area's top dentists. I wanted to ask you, what would you say helps separates you and your practice apart from many of the others?
Well, that's difficult to say. A lot of my colleagues are wonderful dentists, and I would have no problem being treated by any of them. We have truly a family practice here. Many of my patients have been my patients for 30 years now. I'm treating their grandchildren, which
my goodness,
makes me feel aged. But
it also says a lot about you and your practice, that it's been one generation to the next.
But it's a friendly place to come, and I've always maintained my commitment to continuing education. And every year I try to learn and implement a new technology for my practice, so that I remain close to the cutting edge of what dentistry has to offer. Yeah. It's a wonderful profession, and it's getting better every day. The things that we can do for people now are just truly amazing.
Light years ahead of what was available many years back.
My father was a dentist and was an acknowledged excellent dentist. And I never thought I'd be as good as he was. But I have much better stuff to work with than he did.
A lot better tools to work with
Absolutely, yes.
than what was available back then. Yes. So basically, that's what we found too from our research. Your practice, from you, your staff, everyone here really cares about the patients. It is like a family atmosphere. And I think that's very important because, as you know, Dr. Argentieri, one of the biggest fears folks have is going to a dentist. So to go to an environment that truly cares, not just says it, but shows it, in an atmosphere like yours, from you and the staff and everyone, state-of-the-art technology. Obviously, you've educated us about a number of those benefits earlier in this interview. I think it really speaks volumes about you, how your patients feel about you, and the reputation you've built. And on that note, I'd like to thank you, Dr. Argentieri, for joining us and being a guest on our program. We'd love to have you back on in the future sometime.
Thank you very much.
Thank you.